This morning we're here with Dr. Kenneth Iserson, author of the new 8th edition of Getting into a Residency, a guide for medical students, to discuss a vital and troublesome topic for medical students, choosing a specialty. Dr. Iserson, how important is choosing a specialty?
Jen, your choice of what specialty to go into is more important than your decision to become a physician. Your specialty choice will guide how you practice medicine, where you practice, the types of patients you see, the procedures you do, the amount of time you're in the clinic and the hospital, and also how much free time you're going to have in your life.
Do medical students know what specialties and subspecialties are available?
Frequently, medical students are unaware of the newest or smallest specialties, or those that are poorly represented on their medical school faculty or with whom they have little contact. Some of the least known specialties or subspecialties include medical genetics, sleep medicine, undersea and hyperbaric medicine, advanced heart failure and transplant cardiology, physical medicine and rehabilitation, diagnostic medical physics, and brain injury medicine.
Dr. Iserson, MD students can train in all specialties and subspecialties. Do DO students have the same access?
Osteopathic students have access to training in virtually all specialties or subspecialties, either through osteopathic programs for the largest specialties or through MD programs.
What are the most important things to consider when selecting a specialty?
You need to try to find a specialty that you will enjoy practicing for the next 30 to 40 years. How do you do that? You try to match your interests and abilities with those found among the specialists in that area.
How do they do that?
The traditional method has been for medical students to see which of their clinical rotations interests them. The problem is that they're going through relatively few clinical clerkships, and these are all at academic medical centers, which may skew their perspective. An alternative method is to take standardized tests. These can be similar to the Strong Vocational Interest Inventory, which is best taken as far along in your career as possible. Similar tests are the Pathway Evaluation Program, which you can access online, and that compares your results with thousands of similar students and professionals who've taken the test. Access the AAMC's Careers in Medicine site, or take the Personal Trait Analysis test in the current edition of Getting into a Residency.
What should students be wary of when selecting a specialty?
Anything that detracts from a student using their own interests and abilities to make their specialty choice is going to be a problem. That includes the influence of parents, or relatives, or friends, or mentors. Also, making the choice based on their experience with one great clinician or on one excellent clinical rotation is not going to serve them well.
Is there more students should know about specialty selection?
Jen, we'll discuss more about choosing a specialty in the next video.